How are we doing, folks? Hope you're keeping well. So I just got a message in there about a person in my old club that tore an ACL, and they're looking for information about what they should do in the initial stages of it. So they did it 6 weeks ago. Surgery is booked, but what can they do to try and bounce back from that surgery as quick as possible? Well, number one, you need to find out where they're going to take the graft from. So with the ACL, it kind of crosses over in the center of the joint to prevent the joint from sliding forward or sliding backwards. Now, what they can do is they can take the tendon from the patella or the hamstring. Now, depending on where they're taking it from, you want to build up those muscles as much as possible. I wouldn't, if you can tolerate the pain, which there might be some irritation in it, we don't really mind because you're going to get the benefit of it after the surgery. So my advice would be, if it's a patellar tendon graft that you're going to use, get into the gym, get doing your incline squats as much as you're able to. Depending, some people can be quite stable when they have the ACL graft or when they have an ACL injury, and then some people might be a little bit more unstable. It just depends on the person. But you could try some incline squats. You could try some isometric holds, which means just squat down and just hold against the wall for as long as possible. We want to try and add a little bit of weight into that as well. And from there, you just want to try and build the muscle as much as you can. You want to go heavy enough with this, but not so heavy that it's going to irritate you. So kind of a good rep range would be like 8 reps, but we want to build volume. We want to get that muscle bigger. So I want you to do the reps very, very slowly. It doesn't matter if you're not able to tolerate an awful lot of weight when you're doing this, but we definitely want that muscle to work. So let's think about going slow. Think about a metronome where it's going down, beep, up, beep, down, beep. Even going a little bit slower than that will help, but just have some sort of a rhythm or a pattern that will help build that muscle. If it's a hamstring, then you're doing the opposite. You want to be kind of lifting stuff off the ground. You want to be in kind of a B stance where your foot is, let's say it's your left foot that you want to work on. Left foot is in front, right foot is behind, but right foot heel is off the ground, and you're reaching down and lifting things off the ground as much as you can. Again, you want to go heavy, but you want to be able to push that heel down into the ground so you get more activity through the hamstrings. Then you can do your seated curls. For quads, you could do your seated quads. So yeah, there's a few things there you can kind of make up, but just keep it simple. We're not trying to do anything complex. You can start with double leg or you can start with single leg and manage the swelling with some ice. Some people are able to tolerate a good prehab program where it maintains your conditioning. You're obviously not going to be able to run, but you can get on the bike, you can get on the rower, you can go swimming, and you can do a bit of a conditioning session through that. If you need any help with any of this, just give us a shout or send us an email, and we'll be able to help you out as much as you can. But then if we do need to see you, we'll obviously ask you to come into the clinic for a bit of a deeper look. But yeah, the idea behind it is that the more muscle you have going into the surgery, the quicker you'll be able to bounce back afterwards. So let's say this is a person that has this amount of muscle, they go in for the surgery, then they lose the muscle because they have the surgery, and then they begin to build back up. But if you have somebody that has muscle that's up on this level, there's a smaller dip, so you're starting from a higher point. You're starting actually stronger after the surgery. And that's the idea behind it. So it's not going to help you heal quicker, but it will help you build your strength because you have a higher base of strength when you're going into it. That's all you do before your surgery. There's absolutely nothing else you can do. It's just one of those injuries that if it's that unstable that it requires their surgery. There has been instances where you can have professional players that have a lifetime of strength and conditioning knowledge behind them or exposure to strength and conditioning where they're able to actually rehab them so good that they don't actually need the surgery. But look, we're not all professional athletes. We don't have a team of medics behind us, and we all have jobs to be able to contend with. So just be realistic. Set yourself a goal, get out, build the muscles in your quads if it's going to be a patellar tendon graft, or build a muscle in your hamstrings if it's going to be a hamstring graft. And best of luck. Thanks.